By our work, we provide the data, the needed information that should generate into policy. I think you heard the statement by WHO that said that, for example, in Ghana, they outlined 7 key areas, and I don't want to go outside that. He indicated that through Nuguchi's work in malaria, we are able to come up with the drug regimen that if you go to hospital, what is the medication that you should be given based on our data. Because previously in Ghana, when you are sick, you go to hospital, they give you chloroquine. Based on our work, we were able to tell them that if you are older, you see at a certain point, they were calling malaria go slow. Because when we take chloroquine, it was not curing the disease. Through our work, we were able to tell WHO and Ghana Health Service that no, the malaria parasite is no longer responding, it is resistant. Through our work, we were able to move and now to what we are using now, Nuguchi continue. And even after that, we haven't rested on our oars. Nuguchi is still continue to monitor what we call therapeutic efficacy studies, looking at drug resistance, looking at mutations for new, the incurrent medication, even the old ones, to see whether at a certain point you can even bring in them broken back. So this is, I'll give you an example. When you take up malaria, Nuguchi does what we call entomological studies. Through our entomological studies, we are able to talk about what should be used in controlling mosquitoes. So for example, the insecticides, sprays that we are using, Nuguchi is monitoring the bed net, looking at the efficacy, and through these studies, we are able to inform the Ghana Health Service and the WHO what prevention measures are to be done. We heard WHO talking about Nuguchi as a regional lab for polio. And even Nuguchi hosts the WHO emergency supplies. As we are doing research, we also provide opportunity for logistics distribution. This is very crucial in our sub-region because most of the logistics we need for research and for the preventive methods are not produced here. And we have a hub that WHO is using to distribute. Recently, you heard about the health emergency by Ghana Health Service that requiring children to be immunized. It is because Noguchi find the polio virus in the environment, and we informed WHO and Ghana Health Service, and through that, the needed interventions are put. There are so many diseases. We do clinical trials. In fact, you heard them. When it comes to health interventions, Noguchi is leading in Ghana and the South region, the West Africa South region. So Noguchi, and it is very important for development. If your people are sick, how do they work? If you get malaria, you go to hospital and that's okay. If you get influenza, look at the COVID-19. How Noguchi stood even when people were afraid. So, Marburg is like an Ebola. Ghana had Marburg. Within 24, through the collaboration between Nuguchi and Ghana Health Service, we've detected. If I'm sure people in the other world were getting their plane ticket thinking that it's going to be like the Ebola outbreak in some of our neighboring countries. But within 24 hours, because Nuguchi could detect, the needed response was activated by Ghana Health Service, and that led to so many lives being saved. We can't quantify. So as for Nuguchi, when it comes to national development, we are very crucial. And that Nuguchi, because we are crucial, this is an institution that it has to have a budgetary allocation. Research is very important for any country advancement of any country. Without putting the needed funding to allow research, the country cannot go forward. All the advanced countries that have developed is because they put in budget for research. So I think that's what I. So today we are celebrating 45 years of impactful research, and I think Noguchi deserves to celebrate.
Madam, please, are you